So pain relief in labor can be broadly divided into two groups. So the first is methods that require no medication, so what we call the non-pharmacological methods, and then methods that require medication or pharmacological methods. The non-pharmacological methods are the natural methods of pain relief in labor. So things like using breathing exercises, relaxation exercises, hypnotherapy, massage, and also the use of water bath, which is quite popular. The advantage of the natural methods of pain relief in labor is that no medication is involved, which means you avoid the side effects of any medications. However, the drawback is that sometimes when the pain becomes really intense, and especially if you require things like oxytocin for stronger contractions, then it might not be as effective, and a lot of people would require something stronger. Now, if we look at the pharmacological and pain relief methods in labor, the first thing we'll be talking about is the gas and air, something we call Entonox, which is a mixture of oxygen and nitrous oxide. This is a quick and easy method of pain relief, especially in the early stages of labor, and it's a gas that you inhale using a face mask. So it's very effective for pain relief. However, sometimes it makes the room spin and it could induce nausea and vomiting, which we would manage by giving you some anti-sickness. The other method of pain relief is the use of opioid injections, so things like petidine or diamorphine. Now, these are very good for taking the edge off the pain and for managing the early stages of labor. Of course, they have to be timed appropriately. The drawbacks of using petidine has to do with the fact that it has sedating qualities and can cause nausea and vomiting. And also, if it is given within 2 hours of the delivery of your baby might come out a bit floppy, requiring some help and some resuscitation, which is not something anyone wants. Now, the most effective method of pain relief in labor is using the epidural. The advantage of using the epidural is the fact that it's very effective. And also, if you require things like an instrumental delivery or a C-section, the epidural catheter can still be used for those procedures. The drawback of an epidural is that, of course, you require an anesthetist for that to happen, and sometimes the anesthetist is busy, so you might have some delay in your epidural being sited. Also, it reduces mobility, and you usually would need a catheter put in for bladder drainage. And some people, it doesn't work quite as well, so they might need either a repeat procedure or a repositioning of the epidural catheter. Other methods include the use of the TENS machine, or what we call transcutaneous electrical nerve stimulation, which releases small electrical pulses that help to reduce pain, especially in the early stages of labor. The advantage, of course, is that no medication is required. However, just like the natural methods of pain relief, sometimes when the pain becomes quite intense, then it becomes less effective. Other less studied methods include the use of acupuncture and things like aromatherapy. So you can see that you have quite a wide range of options to choose from. All of these options have their pros and their cons. So my suggestion is that you discuss this with your midwife and your obstetrician, or you find the best fit for you. And it'll be interesting to know what you're thinking about. So drop me a comment about what method you're planning for. Are you planning a water birth? Are you planning to use hypnobirthing? Or are you thinking about the epidural? And follow me for more tips.